I rise today to share real stories of real hardships from hardworking families in my home state of Iowa. 7 years ago, Americans were promised that the Affordable Care Act would make health insurance cheaper and health care more accessible. Well, I won't pretend to break any news here. The facts speak for themselves. Obamacare is not living up to its promises. When passing the law, the other side made promises that they knew could not be kept. The irony here is that the so-called Affordable Care Act is anything but affordable. I've heard from many Iowans who tell me in no uncertain terms they cannot afford to buy health insurance because Obamacare is unaffordable. In fact, 72,000 Iowans can't even get help from the exchange because there isn't an insurance company to service them. One Iowan wrote to me, quote, "I am forced to pay $230 a month for a health care plan that covers nothing until I reach $11,000 in deductible. So on top of paying 100% of my medical bills anyway, now I also have to pay for insurance I can't afford," end of quote. So how did we get to this point? 7 years ago, I spoke right here on the Senate floor and predicted what would happen to the cost of insurance if Obamacare passed. So let's go back to that period of time when I spoke in October of 2009. And this is my own quote from that speech. "And while some of the supporters of these partisan bills may not want to tell their constituents, we all know that as national spending on health care insurance increases, American families will bear the burden in the form of higher premiums. So let me be very clear," I said. "As a result of the current pending health care proposals, most Americans will pay higher premiums for health insurance," end of my quote from a speech in the Senate, October 2009. Now, I don't have a magic crystal ball, but it was easy to read the writing on the wall. I knew that layers of new taxes and burdensome new mandates in Obamacare would lead us to where we find ourselves today, a broken health care system that is not better off than it was 7 years ago, and for millions of Americans, including those 72,000 Iowans, much worse. So where do we go from here? After 7 years of rising premiums, soaring deductibles, and climbing copays, Republicans are committed to fixing the damage caused by the Affordable Care Act. Not only is it unaffordable for too many people, it is unsustainable. Obamacare is unable to fulfill its promises to the American people. Here's what every lawmaker in Congress ought to agree on. Insurance isn't worth having if patients can't afford to use that insurance. And the facts are clear. A one-size-fits-all government-run plan from Washington, D.C. is driving insurers out of the exchanges, driving up premiums, driving away customers, and driving up the tab to the tax-paying public. Obamacare has overregulated, overtaxed, and oversold its promises to the American people. Obamacare has not healed what ails the U.S. healthcare system. It is time to move forward. I also want to talk about Medicaid for a moment. Medicaid, as we know it, is not sustainable. The federal government and states spent $553 billion in Medicaid in 2016. That amount is very close to $593 billion spent on the number one responsibility of the federal government, our nation's defense. Every decade since Medicaid started, it has grown faster than the economy. Medicaid now unmatched as a driver of the deficit of our country. We cannot sit by and leave this kind of debt to our children and grandchildren. But dollars are not the only metric by which we measure Medicaid. Medicaid is a program that should supply health care to diverse populations and should have quality measured, but it does not. Medicaid dollars should be spent efficiently, but they are not. Activists in Washington, D.C. are fighting to preserve the status quo and, of course, in the process, scaring the daylights out of the American people. Yet Iowans tell me that there are waiting lists for Medicaid waivers to obtain services for children with disabilities. Others tell me that medicines that will cure diseases are rationed to be used only with those with the most advanced disease. In other words, you have to get really sick for Medicaid to cover medical expenses. It is a fact that Medicaid is not working the way it should for everyone. The time to act to preserve and improve Medicaid as a safety net for the most vulnerable citizens is right now. I'm holding up a letter here because under a Democratic president proposing to do what we're doing, 46 Democrat senators wrote to President Clinton and expressed their words strong support for Medicaid per capita caps. The letter went on to say it would give states the flexibility to achieve savings without cuts to essential services. That is what the current proposal aims to do as well. We are proposing per capita caps as a way to make sure tax dollars are spent wisely on the most vulnerable people in our nation. Medicaid dollars should be spent on a child with cystic fibrosis who needs a blockbuster drug, or a person with severe mental illness should be able to rely on Medicaid for care. Medicaid cannot continue to be a limitless credit card to the states to spend money without any accountability to the people who need it. So I urge my colleagues to put aside partisan dogma and work to solve this problem for the American people.